Hello, and thank you everyone for joining us for week two of our four-part summer series. This week, talking about healthcare options before Medicare eligibility. With that, Ms. Sophia, will you put it over to the next slide for today's presenter? So yours truly at the very top left, really only here is the host and moderator. Obviously, I always chime in with a few remarks along the way. But our special guests today from our team of financial planners, Arash and Sophia, you two want to introduce yourself real quick?
Thank you, Chad. Hi, everyone. My name is Arash. I'm a senior wealth manager here at BFSG. I help clients with financial planning, tax planning, and building a portfolio that aligns with their interests. And I look forward to discussing this topic with you.
Awesome. Hi, everybody. My name is Sophia Liu, and I'm one of the certified financial planners here and also a education specialist here at BFSG. I specialize in meeting with individuals to help them come up with personalized financial strategies and plans to ensure that they achieve the lifestyle or goals that they had envisioned for themselves.
Thanks, you too. And so before they jump into this today, really it goes back to that survey we always ask you to fill out. Is we get a lot of topics that we always ask, what do you want to hear from, and a lot of topics for our team to go through for, what should we bring to the next series or the next year. And obviously, it would be impossible to do all of the different topics that are suggested, but we do try to pull together the ones that are being requested a lot. And this is one from last year, 2025, that we had quite a few requests. As I'm leaving the workforce either because I want to or because I need to before I'm eligible for Medicare, and what should we be doing? And it was amazing to see even last week's survey afterwards had this exact topic requested. So hopefully that person saw it on the little flyer so they knew they could register for it. But this is a brand new deck. We've never done it before. Looking through it, it looks amazing. So hopefully it's really beneficial for all of you that might be in that situation. With that, Sophia and Arash, let me kick it off to you.
Awesome. Thank you, Chad. So today's topic is the Medicare gap, right? And why it's important is because, as Chad alluded to earlier, most Americans think or plan to retire at 65, but many of them actually end up retiring earlier. Now, it could be due to various factors like either their health situation changed or their employer situation changed, etc. And many overlook the gap years before one becomes eligible for Medicare. Right. And so here's an interesting fact. On an average basis, a pre-Medicare household spends roughly anywhere between $10,000 to $20,000 per year just on the healthcare coverage alone. So if you don't plan for the healthcare costs as part of your retirement plan, you might very easily be, having a shortfall in retirement years. And so proactive planning can significantly reduce your out-of-pocket expenses, whether it's that goes towards premium or taxes, etc. Here's what we will be covering today. First, we will be looking at the coverage options. So Arash and I, we will be giving you 6 strategies on how to bridge the gap before Medicare, and looking at the true cost of healthcare coverage because it's more than just the monthly premiums. Then Arash will go into some tax planning considerations. We will also be talking about Medicare enrollment key points like the enrollment windows, penalties if you miss them, and of course, lastly, we will go over a case study to make it more practical and give you also a checklist that you can walk away with to better prepare you for when you are in that situation. So here are the 6 strategies for bridging the gap before Medicare kicks in. So we will be doing a deeper dive into each and every one of them. But here as listed, you can see there's the spouse plan, the COBRA, marketplace, private, part-time, and then finally short-term. So without further ado, we can go ahead and dive into option number 1. So which is joining a spouse or partner's employer plan. So the first option, first one to be considered most of the time because it's very cost effective. You can keep your familiar provider network. So everything stays the same and so on. You don't need to change because your spouse is already on the plan already. So you can also have one plan for the whole household, and immediate enrollment is typically available. One of the things, or some of the things to watch out for as you're considering this option is you will be paying a higher premium, right? So which will affect your monthly paycheck and your cash flow. right? So confirm what you want to do is also then budget that in to make sure that, hey, if you're used to seeing, your monthly paycheck coming in as $8,000 a year, $8,000 per month, for example, now you're down to $6,000. Just again, as a rough example. One of the other things, you want to confirm enrollment deadlines with HR to make sure that you don't miss any eligibility. And here, option 2, we have if you were to continue your employer coverage through COBRA. So what is COBRA actually? So federal law requires most employers that have 20 or more employees to offer continued group coverage up to 18 months. So you get to keep the same exact health insurance, but now you're paying for the whole premium. Right. And COBRA typically can last anywhere between 18 to 36 months, depending on what the qualifying event is. But if we're just talking about retirement from your employer, it's typically up to 18 months. And what we would recommend you to keep in mind is consider asking your HR for the exact premium cost difference before retiring so that there would be no surprises, at the onset of your retirement. You know exactly how much it's going to cost you if you were to pay for the full premium yourself. What you want to be mindful here also with COBRA is that it is infamously expensive. And also you must elect it within 60 days of separation from your employer. So depending on the level of your income, you should also compare this option carefully with the marketplace option, which will come later, and consider the premium tax credits, which Arash will be able to speak to it in a little bit. So with that, I'm going to pass it over to you, Arash, to talk about marketplace.
So Pia, here's your option 3, ACA Marketplace. ACA stands for Affordable Care Act, passed under President Obama, more commonly known as Obamacare. These marketplaces were created to provide affordable healthcare insurance options for individuals. So the good news here with these marketplaces is that when you lose your coverage from your job, you're automatically qualified for what's called a special enrollment period. That means you don't have to wait for the yearly open enrollment window. You can sign up right away. Now, these plans come in 4 different tiers. You have the bronze, silver, gold, and platinum. Basically, bronze has the lowest monthly premium, but you may have higher out-of-pocket expenses if you actually use them. And then platinum is the reverse. You have higher monthly premium, but less out-of-pocket when you end up going to the doctor or getting some prescriptions. The key here with these plans are subsidies. So depending on your income, the government may provide you a subsidy, which is in a form of a tax credit that reduces your monthly bill. Sometimes it's very large reduction, so it can be very helpful. That's determined by your modified adjusted gross income. So planning your income really does matter here. Now, there are some pros and cons here. The pros is that these subsidies can make the plan very affordable, and you can't be turned down for pre-existing conditions. And you've got a wide range of plans to choose from and a network to choose from them as well. But there's a few things to watch out here. These credits can only be applied if you enroll to the plans through the marketplace. For example, here in California, you would get enrolled through the Covered California. If you buy a similar plan directly from an insurance company outside of these exchanges, you lose that subsidy. Also, if your income comes in above 400% of federal poverty level, which would be roughly $63,000 per individual or $130,000 for a family of 4, those credits can shrink or disappear. So it's important to kind of keep an eye out on your income to make sure you qualify for these subsidies. Provider networks vary from plan to plan, so it's worth double checking that your doctors accept these plans as well. There are also other things to keep an eye out. When it comes to these ACA marketplace plans, silver plans tend to give the best bang for the buck. So it's something to keep an eye out. And if you're looking for plans, look for the silver plan, usually tends to be the best option. I know some of this information can get a bit complicated, But in my experience, calling these exchanges and talking to some of those representatives can be very helpful. I've called them with a client on the line to help them get a plan, and they are very knowledgeable and can help you figure things out as well. Again, the idea here is to lower your income as much as possible or keep an eye out on your income to qualify for as much subsidies as you can when it comes to the ACA marketplace plans.
Perfect. Thank you.
The next option, option 4, is private coverages outside the marketplace. So you may consider these plans mainly if you don't qualify for monthly premium tax credits or those subsidies that we just talked about, and because you have too much income. So if you have too much income, you don't qualify for subsidies, you can go directly to health insurance providers to get some health insurance plans. With these plans, the benefit is that you can't be turned down because of your health history, and you have a lot more options to choose from because you're not going through the marketplace, so you have more plans available to you when it comes to the private coverages outside the marketplace. Some things to watch out for: if you buy a plan off the exchange and directly from an insurance provider, then you give up any tax credits. So if there's a chance your income may fall and you may qualify for subsidies later in the year, then it's best to kind of try the marketplace first and then look at the private insurance options as well. Again, there are many plans available to you when it comes to the private option, and so you may be better off working with insurance brokers to help you make the right decision.
Perfect. Another option to consider is perhaps working part-time and slowly phase into retirement, which brings us to option number 5. And so some employers extend group coverage to part-time workers, and since you'll have continued income, it may reduce your portfolio withdrawal needs. So if you're in consulting business or if you are self-employed, this option may actually allow you to continue your health savings account contributions. So that's one thing to keep in mind. But on the flip side, again, caveats or things to watch out for, because you're still working, right? You have earned income, and that earned income may reduce your potential government subsidy. So if you're taking, and also if you're taking Social Security before full retirement age, the benefit amount may be permanently reduced. And as always, what you should consider is weigh the trade-off between, the coverage, the health coverage against your work-life balance or also your lifestyle, right? Also be sure to check with your employer regarding the benefit eligibility as well, because not every employer extended to their part-time employees. Lastly, we have short-term health insurance. This option offers fast enrollment. It's often the same day or typically the next day, and the maximum term is typically up to 12 months. But in some states, it could go up to 36 months. It really just varies state by state. So I would definitely check with the state that you are residing in. And what it is premiums may be 50 to 80% lower than the ACA or Affordable Care Act equivalent plans. So it's a very useful tool, I would say, when you are bridging, the gap years while waiting for open enrollment to kick in for Medicare. However, one of the biggest downdraw or downside about this option is that it's not available in every state. So some states even ban or heavily restrict the plans. So it's best suited for, and also this option is best suited for, healthy individuals with low near-term Medicare needs or healthcare needs. So definitely something to watch out for.
Sophia. So now let's talk about health savings accounts, and most commonly known as HSAs. Many of you probably heard of them. Here's what makes HSA or health savings accounts special. It has a triple tax benefit. First, your contributions go into these accounts, and they're tax deductible. Second, any earnings or investment gains are tax-free. And third, when you take money for qualified medical expenses, that withdrawal is also tax-free. So you contribute and you deduct it for taxes. The account grows tax-free. and also withdrawals is tax-free. So it's a fantastic deal. Rarely happens when it comes to government to give you this many tax breaks. So it's something we definitely recommend our clients to take advantage of if they are able to do so. With these accounts, there are some contribution limits set each year. For example, for 2026, it is individuals can only put 4,400 away into these accounts, and a family coverage can put up to 8,700. And those over the age of 55 can put an extra $1,000 as catch-up contributions. So a few practical things to know about HSA is that to even open an HSA account, you need to be enrolled in an HSA eligible high deductible health plan. So you need to have a high deductible health plan, then you're allowed to open an HSA account and contribute to it. So there is no use it or lose it factor when it comes to HSA. So the money you put away to use it for medical expenses can be used later on in future years. It is not like FSA accounts where you have to use it that year or only a certain amount carries over. So it's definitely a good tool to build up some reserve for medical expenses in the future. And here is a key transition point when it relates to Medicare. Once you enroll in Medicare, you have to stop making any new contributions to HSA, but you can still use those funds tax-free to pay for premiums or any medical expenses that come up in once you enroll in Medicare and for future years. So it's a great tool, a great investment vehicle to have to save for your medical expenses.
Okay. Next, we will go ahead and shift gears a little bit to talk about the cost and tax planning, and again, how it builds up understanding the true cost of the healthcare. So we will be doing a deeper dive, right, into more than just your health insurance. So what are really exactly the cost, the true cost that makes up the cost of your health insurance? So one, we have the monthly premium. So this is a recurring monthly fee that you are due to pay to the insurance company. So in order to keep your insurance even active, so even if you don't visit the doctors and so on, you still have to pay this monthly premium. And then two, we have the annual deductible. So think of this as like a fixed amount of money you must pay completely out of pocket for covered healthcare services each calendar year before your insurance company will actually kick in to pay the bill. And then number three, we have the co-pays and co-insurance. So copay is more like a flat fixed dollar amount that you pay each time. Let's say, for example, when you visit your doctor's office, right? Just no matter what, you pay the $20, for example. Co-insurance, it's your share of the medical bill that is calculated on a fixed percentage. So for example, your plan, the one that you've chosen might just say, okay, you're on the hook to pay 20% of the total cost of the service. And then we have prescription drug cost. This is what you pay for the pharmacy medications. Again, it's typically in addition. And then we have number five, out-of-network care. So for doctors, hospitals, or clinics that do not have a contracted agreement with your insurance provider, and you want to continue to see these specialists, right, that are just somehow outside of your network. And so what that means is that it will cost you significantly higher fees. Number six, we have dental, vision, and hearing. These three are typically excluded from the standard major medical plans, and they require specialized supplemental coverage. So it's additional cost to that. And then, of course, we have emergency reserve, right? It should be a liquid cash reserve just dedicated to cover urgent or unforeseen major expenses, such as medical emergencies and so on. And when we talk about healthcare, I think we often think it's just the monthly premium, right? That's probably the first thing that people focus on. But as we just discussed, a few seconds ago, it's so much more listed on this page. So low premiums does not always equal low cost. And so let me give you like a worst case scenario, for example. So you have the premium plus the deductible plus your out-of-pocket maximum. right? And so if you look at, for example, a 60-year-old individual on a Affordable Care Act, or I'm just going to call it ACA going forward now, ACA Gold Plan, right? And they have a medical procedure and so on. This could easily cost them over $25,000 in a calendar year. Okay, in a bad year, I would say, if they need, their health situation is not so, it is not ideal.
Healthcare can really be expensive, especially these days. So now let's talk about some tax planning. Your health coverage costs and your tax planning are connected during these transition years to Medicare. So those premium tax credits or subsidies we just talked about a few slides ago are based on your modified adjusted gross income, which are measured against the federal poverty levels. So you want to plan to minimize your income during these years to qualify for the most tax credit, which would lower your monthly premiums. So it is important. Sorry, go on.
Arash, let me put a question because I think it'll help, especially anybody looking at this question, so that they're not thinking about their question while you explain this. It's how many years back do the exchanges look for your income quals for these credits?
So they typically look at your prior year or ask you for an estimate for this year. So you got to be mindful because if you give a low estimate and you end up having higher income, then they can come back and reverse the tax credit premiums that they provided you in advance, and you will end up paying those back. So it's typically prior year and then an estimate for this year.
Yeah, I think they use an estimate for your actual credits based on this year, but they verify it with prior year. So if you know it's going to be lower this year, then you're going to need some evidence of why that's going to be the case because they're going to use last year's tax return. So I think you're about to talk a lot about that. So I want to make sure that the answer to that question was out there.
Well, definitely. It's very important because it's all about income planning, right? You want to see what type of income, how much income you have, and to make sure you get the most subsidies here when it comes to these coverages through the marketplaces. So again, you want to lower your income or keep an eye out on your income, get the most subsidies so your monthly premium is the lowest. And what is important is not just how much income you have, but what type of sources of income that you're pulling those funds from. So there are treated a bit differently. So here on the left-hand side, we see different types of accounts that an individual may have, and they are treated differently when it comes to taxes and when you take money out of those accounts, how they impact your income and your subsidies. So starting from the top, if you're pulling money out of your traditional IRA account or rollover IRA or a 401k, 403b, any pre-tax retirement account, that money that's taken out is fully counted as income and can bump up your income and lower the subsidies that you qualify for, depending on where you land at the end of the year with your total income. And then on the other hand, the Roth IRA withdrawals, if you're over 59 and a half and you're pulling money out of those accounts, you already pay taxes on it. So those do not impact your income and they're very subsidy friendly. When it comes to taxable brokerage account, your investment accounts that you have, if you sell some investment and you realize the gain, that gain counts toward your income. So it could impact your subsidy. So you want to be mindful of how much capital gains you trigger by selling stocks or other securities. Then HSA accounts, those health saving accounts that you put money away for your medical costs in the future, if you pull money out of those accounts and you use it for medical expenses, they do not impact your income. So they're very subsidy friendly to pull money out of that account to pay for your premiums or medical cost. And then when it comes to Social Security, if you start taking Social Security when you retire and it's before Medicare, up to 85% of your Social Security income could count toward your modified adjusted gross income and impact your subsidies. So it matters where you pull funds from when it comes to planning for these subsidies. And on the right-hand side, we have a suggested order for tapping into your retirement accounts and your different accounts so you don't lose too much subsidy. So this is like a general guideline for each individual, have a different situation. But typically, you want to use your cash reserve because that doesn't impact your income. Or you can tap into your taxable brokerage account, but be mindful of the gains if you're selling stocks. HSA accounts are great if you're using it for qualified medical expenses. And then you can pull money out of the Roth account because it's not taxable, the money you put out. And finally, you can always touch your IRA account, 401k, 403b. But just know that once you pull money out of the account, that the amount you pull out is counted towards your income and could impact your subsidy. So there's some planning that needs to be done. It's not the decision that you make once and you forget about it. It's a year-by-year balancing act between your retirement accounts, your tax bracket, and your health insurance costs. And it's a good idea to work with your financial advisor or planner to kind of plan for these withdrawals as you transition to Medicare.
Yes, one note too, just because by traditional, which is pre-tax, this is IRA and 401k, which is also 403b, 47, that applies to Roth too. Like you might have a Roth IRA, but even in your employer-sponsored account, your Roth 401k, 403b, or 457 is also not subject to modified adjusted gross income.
Great point. Thank you, Chad. So on to the next slide, which is basically a checklist here. Because this checklist, I think, is very helpful because this is where people kind of get burned when it's surprise costs, even after making a very smart plan on paper. The core message here is that a plan can look great on paper, good premiums, great subsidy, and still fall apart if in your practice, the doctors aren't accepting it or the medical prescription drugs that you need aren't covered in the plan. So we highly recommend that you start with your providers and networks, call your doctors and your specialists, make sure they accept your plan. Some of these ACA plans, in our experience, some doctors may not accept them. So it's good to make sure the marketplace plans that you sign up for are accepted by your doctor. Next, you want to check out your prescription drugs, look up each of your medication specifically and see if it's covered by the plan. You want to check the exact drug on the different plans to see where they fall cost-wise. Sometimes they're cheaper in different plans. And also there are other mail order pharmacy options in case you want to check them out in case they're cheaper over there as well. And finally, on this slide, we can see there is also some planned rules and timings. So some plans require pre-authorization to cover certain ongoing treatments. So you want to be mindful if this is something applicable to you and time for that if in case you have some operation coming up. And finally, you want to keep an eye out on enrollments and see when it's coming up and review your plan and needs every enrollment because you may qualify for a cheaper plan or your medication may have switched from one plan to another. So you want to make sure that you're getting the best deal every year when the enrollment comes up.
Perfect. Super helpful. With that being said, now we will kind of switch our gear a little bit to talk about how we can plan ahead for a Medicare when it kicks in at 65. So here's a snapshot of the enrollment period, especially at the top, you can see it's the initial enrollment period. And there are penalties if you miss certain deadlines and so on. So let's go through each one of them. Initial enrollment period, it's a total of 7 months, right? And so 3 months prior to your birth month, and then also 3 months late after your birth month. So if you're already receiving benefits from Social Security, you'll automatically get enrolled into Part A and Part B Medicare. And so starting the first day of the month that you turn 65. At the bottom here, you can see there's also the special enrollment period. So this is an 8-month special enrollment period that you can sign up for Medicare Part A or Part B that starts the month after your employment ends or the group health coverage ends, whichever happens first. And so it really applies to those who are covered by an employer and their group plan is larger than 20 employees. And so sometimes you can also, what triggers the special enrollment period is, let's say if you were moving to a new zip code, for example, or if you somehow lost your existing insurance coverage, or you were switching, from your employer coverage to Medicare, that will all these, are examples of what can trigger the special enrollment period. Here you can see if you were to you're supposed to enroll in Part B, but then if you were late, here it clearly states, right, there's a 10% premium surcharge for every 12-month period you were eligible but did not enroll. And keep in mind, this penalty is actually permanent, so it applies for the rest of your life. I know, disgusting. There's also Part D, which is another late penalty, right? Maybe not as much as 10%, but it is still 1% per month for each month without creditable drug coverage. And again, this is added on to your monthly premium indefinitely. So these are some of the things to watch out for. Not going to get into all the details here, but just wanted to make sure that you are aware. Here at the bottom right hand corner, we have Medicare Advantage versus Medigap. Again, very high level. Medigap is really known for the supplemental plan, and it's the enrollment. Its enrollment is most flexible, right? So it's within 6 months of after you have Part B already. And after that, if you were to sign up after that, most of the states require you to go through underwriting.
I'm going to note that Part D penalty, if you did wait a whole year, is actually worse than the Part B penalty. 1% a month is actually a 12% penalty.
Great math, Chad.
They just don't make you wait a whole year and say 10% now. They just say every month we're going to tack it on.
Yeah, that's very true. Very sneaky of them. All right, so let's pivot now a little bit to talk about a case study. So to make it more practical and to paint the picture for everybody. So Arash, why don't you take us through the scenario, please?
Thank you, Sophia. Yes, the case study usually is very helpful to cover the information we discuss on these presentation. So here is a case study covering a couple. We have Pat, who's retiring at 62, 3 years before Medicare eligibility. And Pat's spouse is 60, not working, not eligible for Medicare either. So they both lose their employer-sponsored group health coverage. And Pat needs coverage for 3 years to Medicare, and the spouse needs it for 5 years. And they have several accounts to pull resources from. It's their IRA, Roth IRA, taxable brokerage account, and their health savings account or HSA accounts. And here for this case study, this couple has an annual retirement spending target of $90,000. So that $90,000 includes their, for example, mortgage, property taxes, their living expenses, travel, and also their medical expenses.
Okay, thank you for that. Now, I guess the first question that we have is, with that being said, should Pat use Cobra first, or should he go directly to the marketplace? Which one do you think, what would be the better choice?
So every situation is different. For Pat, for example, here, the recommended approach would be to go to an ACA marketplace and see if they qualify for plan with subsidies. For example, a silver plan that provides great subsidies and has other perks when it comes to cost savings. So, our general approach would be go to that plan, see if you qualify in a marketplace for a plan like a silver plan, but Cobra may also kick in case he has unusually high income in the first year of retirement. That happens if you have a severance package or a bonus. Then you want to use Cobra because you're not going to qualify for subsidies either. This way, at least, is simpler. You can carry on the health insurance that you have, and you're familiar with it, and your doctors accept it. So Cobra comes into play only if you don't really qualify for the subsidies. Otherwise, if you don't have much income the first year of retirement, you're better off going to these ACA marketplaces and get a plan with some subsidies.
Got it. Okay. And how would you say the household withdrawal strategy? So with that being said, we know that they have a few resources, right? Various accounts and taxed differently, of course. What would be their withdrawal strategy? And also, how will it affect, the marketplace subsidy that we were just talking about earlier?
Yeah, great question. So again, when it comes to this, you want to keep your income low. So you want to tap into your cash reserve first, then maybe your brokerage account, if you can take money out without triggering too much capital gains. If you have some medical expenses, then you can tap into your HSA account, use it for the qualified medical expenses, such as your premiums, your prescription, and your doctor visits. Then you can tap into your Roth accounts, because those don't impact your income either. And finally, you can always touch your pre-tax retirement accounts like your IRA or 401k or 403b But just, you have to be mindful of the thresholds that impact the subsidies.
Got it. And what would you say is the recommended cash reserve that is needed that one should just keep in cash and not invest it in the market?
Well, every situation is different. So every person's health condition, medical needs may be different. So if you expect to see less doctors, then you may not need as much cash on hand. But if you have a health condition or require to visit doctors more often, then you want to have more cash on hand. In this case, for example, they don't state any medical condition. So I would say anywhere between 6 months to 1 year having on hand would be sufficient. But again, if you have health conditions, some operations coming up, you want to have more cash so you don't tap into your, for example, investment accounts when the market is volatile or it's down.
That makes perfect sense. Lastly, what changes when Pat reaches Medicare? So let's say Pat is already eligible for Medicare, right? At 65, that's when he enrolls. But then let's say his spouse is still pre-Medicare. What are his options or what changes then?
Sure, that makes sense. So, initially, let's say if they went into the ACA marketplace and got a plan, it makes more sense for them to have the same plan. It's simpler that way, probably cheaper if they're both on the same plan. But as Pat goes into Medicare, then the spouse can find a plan that's more suitable for her needs or his needs. And they can just do another search on marketplace and find a plan and maintain in that plan for 2 years while they qualify for Medicare at 65.
Got it. Perfect. So this page is really just a recap of what Arash had answered, right? The for the recommended framework. So we would like to just pause here. If any of you want to take a screenshot, obviously you will be able to have access to the recordings and the deck and so on. But just wanted to pause right here. And as you can see, everything was summarized. Kind of going back to the previous slide, all the questions that normally we get or typically one will think about, this is sort of the decision, recommended approach, and then also what are the key reasoning behind it. Okay.
And on this slide, we basically have a recap of the 6 options we discussed to bridge that gap to Medicare if you retire before Medicare years. So here are the options again, starting from the top. We have option number 1, spouse plan, which tends to be the lowest cost option. If your spouse is still working and has coverage, you can get added to that plan. Option 2 is Cobra. So the benefit of this option again is that you get to keep your same doctors and the same plan, but you only have it for 18 months and tend to be expensive since your employer is no longer paying for it or covering some of the expenses. It could be very expensive. Option 3 is the ACA marketplace or Obamacare. You can go to these exchanges offered. Again, for example, in California, they have covered California. You go to their website and you look at the options available to you. It can be very beneficial because if your income is low after retirement, you get a lot of subsidies and it's more manageable to get these plans. Option 4 is if you have high income and you're not going to get much subsidies, then you can go directly to insurance providers and get plans directly from them. And you have more options available to you privately. And for some doctors may not accept marketplace insurance, then you can get it privately and you can visit the doctors that you need. Option 5 is part-time work. Again, some part-time employers may provide insurance and also you could earn more money to cover some of your insurance costs. So that's a good option here. And lastly, we have the short-term insurance, which tends to be the cheapest option. And some healthy people who don't expect to have much healthcare needs could use that. But as Sophia mentioned, some states don't offer it. So it can be a bit of a risky approach if you do end up with some health needs and the cost could go high there, but there is an option there as well. So bottom line is that there is no single right answer for each person. It comes down to your income, your health needs, and how long this gap actually needs to go on for till you hit Medicare.
Perfect. Thank you. And I just remembered, I know that a lot of times we get questioned or we get asked, hey, but maybe when I'm working, I'm still going to be, let's, for example, use California because we're in California. So let's say while I'm still working, I'm going to be in California, but during retirement years, I'm actually going to move away from California. Then what does that look like? And, for changing the residency and so on and so forth. So typically, again, short-term insurance can be a good way to kind of bridge that gap. And typically you do get a, what do you call it? Like a short-term, 3 consecutive 3 months. So you can go without, I know for particularly in California, you can go 3 months consecutively after separation from your employer without coverage, and you're still not going to be penalized. But then again, you will need to prove that you moved, right, 6 months away. So to move your primary residency to another state. So probably you need to think of ways that will help you to bridge that remaining 3 month gap just to make sure that you don't get penalized in California for this instance, because you do get penalized if you don't have eligible or creditable insurance and so on.
So I love that you mentioned that. Let me drop the question that was on that exact topic before we finish up. I know we only have a couple slides left before we get to the Q&A anyways. But this was a person knowing there's a penalty in California, and like, what are the exceptions if they plan to not stay in California for 6 months or more? I think you covered it. Like, you could technically go 3 months, right? And there's like a code, like a letter, I don't know, it's like a B or a C you have to check or something like that to get that exception. Anything beyond that, whether it's another 3 months, all it is a reduced penalty. So California, like if you're non-resident of California, if you still lived here for 3 more months, they would still give you some level of penalty from a tax perspective. But you would not pay a penalty for any months you did not live in California if you were planning to skip time.
Awesome. Perfect. Okay. Excuse me. So this slide is also a good one if you want to take a quick snapshot of it. And here is basically we're giving you some of the basic, a checklist, right, for all different angles, if you will. This is a checklist of items that you should definitely consider and confirm and review before you make any decisions. So regarding the coverage, right, when is the last day of your employer coverage? You definitely want to confirm that. And then also before you pull the plug from work, you definitely want to check with HR to see, hey, if I were to continue with Cobra, right? If instead of paying, a portion of my premium, now I have to pay for the whole premium, what would that amount look like? And then, of course, double check if your spouse partner plan availability is available to you. And then, of course, see if you can review the state marketplace option prior to you, just to kind of do, your due diligence. And then when it comes to cost and budget, right, make sure that you get a rough estimate. And then also the premium tax credit that Arash was talked about earlier, also kind of look at the eligibility and estimate it as well. And then model out, hey, what if I were to keep my current or desired plan and what's the maximum out of pocket that I will have to pay on an annual basis? So we can also model that. We have the tools, we can model that into your financial plan. Definitely, if not, consult with a financial planner or a financial advisor. And then, of course, depending on, everybody's health situation is a little bit different. So this is going to be subjective in terms of how much cash you should keep on hand just for medical emergencies. But it is definitely good to talk with a professional to kind of map that out. Providers and prescriptions, key doctors confirmed, right? Maybe some doctors, they change the network. And real example, it just happened to one of my friends last week. She called the insurance company, and the insurance company said, oh yeah, this doctor is still in our network. Yeah, she's now expecting a $2,000 bill because the doctor that she went to is no longer in the insurance network. So what I'm not trying to scare you or anything, but it's just that do go the extra mile, go the extra step. Always call that one doctor that you have been working with for years to make sure that they're still in the network, because sometimes insurance, they don't update their database. I know they should be, but the truth be told is they just don't. And you don't want to be surprised with, a couple $1,000 bills. Hospital specialist access, again, kind of on the same note, you want to make sure you have access to the ones that you want to continue working with. Prescription formularies, you want to review them as well. And then, of course, estimated annual drug cost. That kind of rolls up into, the whole Medicare cost, right, during retirement and so on. Tax and Medicare planning that we talked about a little bit. Also, multi-year income projection. Do you continue to work, or are you going to work part-time, slowly phase it out? What does that look like? Are you going to do side income or consulting on the side, etc.? Those are definitely conversations that need to be have. And then, of course, if you are self-employed or if you are special, consulting business in your retirement, right, you may be still able to contribute to your health savings account. And then, of course, looking at the Medicare enrollment timeline, again, I think one of the misunderstanding or big questions that we also get a lot is, hey, what if I don't retire before 65, right? What if I keep working until 70, let's say, and then I have employer or I have health insurance coverage through my work? Then, do I still need to sign up for Medicare? And the answer is actually no. You can postpone your Medicare plan because you have eligible healthcare, creditable healthcare insurance through your provider or through your employer. But again, just double checking the timeline because everybody's situation is a little bit different. So you want to kind of review those things for Part B and Part D, especially because they have penalties attached to it.
Sophia. So this slide is a recap of this presentation, which we hope you found it useful. So again, Medicare doesn't start till 65. The gap from to Medicare is real, and many individuals need to start planning for it before retirement. Again, there are 6 options to bridge the gap. The right one depends on your timing, your health needs, and your income strategy. The monthly premium is only part of the cost, as Sophia mentioned, and always model your worst case scenario so you're not surprised down the line. Your taxable income is directly related with the market subsidies that you get. So how you sequence your withdrawals from different accounts really matters. So be mindful of that, or work with a financial advisor or planner to help you figure those out. And finally, the real takeaway here is to plan ahead of your retirement and not after, because managing this gap is doable, but you just want to do it in a way that is stress-free transition to your Medicare.
You can skip to the next one for thank you. And thank you too. We have a few really good questions in here. I'll get to in just one second. Hopefully some of them actually will be in the chat link. I definitely recommend, please do type your questions into the Q&A box still, but definitely open up that chat box. I did post a few links. Always the survey. Again, instead of screenshotting, there's a link to download the PDF slides. So especially those last few slides that kind of tell you next steps, what to think about, things to not forget no matter what. You can find all of those in the PDF link to today's slide. Again, I don't think Zoom lets you copy links out, but if you click them, they should open up in your browser so that you can review them after you drop off the call today. I did post a link to register for next week's session, Finding Your Retirement Mindset, which is an amazing session. And then there's a question in here I'll get to in a second on, just what is Medicare Part A and B? And I'll explain that in a second very briefly. Although the idea of today's presentation was what to do to bridge the gap before Medicare eligibility. The session we're doing on August 6th, which is Social Security, does conclude the last few slides talking a little bit about Medicare eligibility, because those tend to happen in the same years as well. They'll go a little bit more in depth than we did today on Medicare, but actually talk about what's the difference between Part A, Part B, Part C, and Part D, although I will explain it briefly in a moment. And then, of course, a link to us on YouTube. So the first one I have, just because I was talking about that Medicare Part A and B, we don't have a slide on it in this specific deck, which is really meant to be pre-Medicare. But really the differences between the two to address the question is Part A helps pay for hospital stays and inpatient care, and Part B helps pay for your doctor visits and outpatient care. So I definitely would tune in August 6th. Otherwise, check us out on the YouTube channel or our website. We did do a session this time last year that had the same content in it as well. We try to do Social Security and Medicare every single year. That at least has a little bit of details on that's just Part A and Part B, but what about the premiums for these, and what is Part C, what is Part D, which one's right for me? And then there's another question is, I think this is the next one before I get that's in the chat box, and maybe you two can opine on this. Do we recommend using an insurance broker to explore these options? And what are the typical fees that you'd address? I think not making any recommendations. I think for that person, if you reach out to us, we definitely work with quite a few of them. Some of them are really good. Some of them like to sell you a bunch of stuff you don't need. So definitely reach out and we can give you a direct name.
Yeah, when it comes to insurance brokers, in our experience, insurance brokers get paid by the health insurance companies, so there are no fees upfront from you to go talk to them. But they will go through your different plan options and depending on your scenario, make suggestions to you. But in my experience, they don't get any fees from individuals; they get it from the health insurance providers, and it doesn't impact your plan fees or anything like that. So it's a good idea. And to work with a broker to kind of see your options and have a better understanding of what's out there and available to you.
Yeah, I would second that too.
Yeah. Okay, so I got one question here, and this goes to somebody that rather than retiring before Medicare eligibility, might be still working, right? Or sorry, maybe they have no job or they're already retired, so they're definitely out leading up to Medicare. So example, somebody 65 years old, still working, health insurance, hasn't enrolled in Medicare, will be 66 in 6 months, still plans to work for 6 more months, probably won't retire until they're forced. Will they be penalized for not signing up for Medicare at age 65? Or at what point would they be penalized for not signing up at Medicare, assuming they're still working at 65?
Yeah, so one of the exception to that rule, right, is that if you have active employment. So if you're still working actively and beyond 65, then no, your insurance, primary health insurance through your work will actually make sure that you are exempt from it. I would say the only time what it will do is it will trigger you're right, because you are the initial enrollment period is when you turn 65. So obviously you're going to be working beyond that. And so what after you separate from service, what it will trigger is the 8-month period for the special enrollment window. And you definitely want to make sure that you sign up for Medicare at that time when you separate from service.
Okay, the next question I have here is there was a comment about would we confirm if you said 403(b) plans are not counted as taxable income? That is not specifically what was said. Any 403(b) assets that are in the pre-tax source, which would be anything you saved in elected traditional or pre-tax 403(b), or any employer contributions that have historically always gone in on a pre-tax basis, will be considered taxable towards your modified adjusted gross income. Any savings in your 403(b), and same for 401k or 457 plans that you've elected the Roth source, which is similar to a Roth IRA, but inside of your employer-sponsored retirement plan, any 403(b) assets in that Roth source would not be subject. So it's very specific, just pre-tax versus Roth. It doesn't matter if it's a pre-tax IRA or Roth IRA or pre-tax 403(b) or Roth 403(b). Pre-tax will be subject to taxes and Roth will not be subject to taxes. Okay, so I got next one, and you did have a slide for this, Sophia. If you jump to, I think it was slide 15, is can we discuss the look back period for Medicare enrollment and how people that can reduce their income in anticipation of that? And I think that probably the suggested spending sequence.
Sorry, back. Yeah.
Yep. And you maybe want to talk through like the right-hand side one more time and then kind of like why this helps reduce their taxable income in retirement.
So when it comes to this slide, this is a suggestion regarding spending sequence for the time when you retire before Medicare. Because when you're going to the ACA marketplaces to get plans, they look at your income, and depending on your income, they provide you subsidies. So as far as the question goes regarding Medicare enrollment, when it comes to Medicare at age 65, the Medicare looks 2 years prior to see what your income was, and based on that income, they set premiums for your plans. So if you already qualify for Medicare Part A, there is no fees, but you have to pay Part 2, Part B premiums. And Part B for majority of people is about $202 per month. But if you make too much money, then it can be higher. So as far as your question goes, the look back period for Medicare, you had to reduce your income in anticipation for that. is they're just going to be mindful that a few years before Medicare starts, how much your income is. But technically, when Medicare starts, if 2 years ago your income was very high because you were working, but at 65 when Medicare starts, you're not working, there's a form you can fill out, tell Medicare that, hey, I'm not making the same amount of money it was 2 years ago. So this is how much I anticipate to make this year, and they will reduce your premiums. So what you could do if you have, for example, very large pre-taxed accounts, you can do some Roth conversions before Medicare starts to lower your RMDs down the line. But this is a separate topic. But generally, you just want to make sure you don't have too much income once Medicare starts, so that your premiums for Part B doesn't go up too much.
Next one I have for you is, if you're on COBRA, can you delay Medicare enrollment without penalty?
Oh, that's a great question. No. So the only way to get around, well, one of the few ways, exceptions to get around Medicare, not having Medicare or not enrolling in Medicare at 65 is active employment, and that through your active employment, your current or your active employer offers you creditable, health insurance and so on. So if you're already not working, then you would not qualify for that, because you're already on COBRA. And I think I've run into cases before where it's pretty interesting. If you're on the COBRA, and sometimes they might refuse if they find out. I mean, obviously, I don't think the two agencies talk to one another, but they will be able to find out, hey, you are actually eligible for Medicare, but you don't enroll. So you do get penalized from Medicare. And also in cases, not ideal, and I'm not here to scare you, but I have seen it happen where COBRA actually refuses to pay out for, certain like percentage of the coverage. So just wanted to watch out for that, okay? And so if you are eligible, 65 and older, and you're not actively employed, you definitely will need to file for Medicare, enroll in Medicare to avoid any penalties.
Good question. Okay, next one. Hopefully none of our employer clients are upset with us for this one, but employer doesn't offer HSA, but they do offer FSA. Just thoughts on why an employer wouldn't offer. Can you have both? Pros and cons of HSA versus FSA. So let me start with the first one. Is not every employer wants to offer a high deductible health plan, which means you really can't even use an HSA if you're going to use employer's insurance. They are becoming more and more common, but I think just from a pure benefits package, it is complex for a lot of benefits teams to go through all the different offerings and make sure it's at least simple for all their employees to offer too. And so I don't know if there's a good answer why one would or would not offer that. But HSAs and FSAs are very different. HSAs never expire. FSAs, the money typically does. Like, you need to use most of it in the year saved. And often there's like a small amount you're allowed to roll over. Like, oh, it's like $500 though. So it's definitely like a use it or lose it. So be very careful. Make sure you're going to use it. Although there's a lot of just fun things at the end of the year that, like, me and my wife use, like, you can buy Band-Aids and sunscreen, like, and you get to the end of the year and just, we need to knock out a couple $100 and buy, like, we load up on sunscreen for the next year. But for you two, like, pros, cons of HSAs and or FSAs?
Well, HSA, as mentioned earlier, is a great savings account for your medical expenses, because you can use HSA. You can put money away, it reduces your taxes, the money grows tax-free, and the withdrawals are also tax-free when you use it for medical needs, right? And one thing with that HSA is that you can put the money away and just invest it, and you're allowed to do that, and that money can grow, and you can even pay your medical expenses out of pocket and reduce it, and declare it with your taxes, and use that HSA money down the line for example, your Medicare premiums, and just leave that money to grow tax-free. So there's a lot of benefits when it comes to HSA. FSA is, some employers offer it as a great tool as well. If you don't have access to HSA, it's a way to save on taxes and employer benefits. I think it's a nice perk to have. It's just there are different tools HSA account, you have to be mindful that it's only available for high deductible plans. So if you're somebody who visits doctors quite often, it may not make sense for you to have HSA high deductible plans because you have more out-of-pocket expenses, but it goes on. So some younger folks or some people who don't need to visit doctor as much may get up for a high deductible plan because it has lower premiums, monthly premiums, and they can take advantage of HSA. So it's just different tools, I guess.
Cool. So next one, I'm still going to the Q&A box, and I'll come to the chat box. I see a few in there too, although some might get answered as we answer these questions too. But when you turn age 67, are you automatically enrolled in Medicare if you're still working?
No, you do have
No.
to file for it. You do have to, have to file it yourself, just like Social Security. It will not automatically enroll you, so you do have to go ahead and file for it.
I think there may be a confusion with this question. So if you're already enrolled in Social Security and you hit 65, you get automatically enrolled in Medicare. So 67, I don't think plays any roles in this conversation. Just may have been a misunderstanding.
Yeah, and that's still just parts A and B too, right? If you've already signed up for Social Security, then you get automatically enrolled in Medicare. But I think for anybody that delays Social Security to age 66 or 67 or even 70, you would have to enroll in Medicare separately.
Yep.
Okay, next one. If you're still employed and are you required to sign up a Medicare if you're under your spouse's plan? Or could you join your spouse's plan so you're not penalized?
That's a good, interesting one. Yeah, go ahead, Arash.
Sorry, so the question was if you're sign up under your spouse's plan, if you're unemployed, right? If that's the case, I don't think there is penalty because you're still under their spouse's plan. That is my experience.
Yeah, you're still under an employer plan. And so the next one I have, it's the same thing, but just so I asked it the exact same way, since I last asked the last one differently. What if your spouse retires before you do? You still have coverage. Can you add them? Answer is yes. Absolutely. And what I tell you is, and I think for all of you, I'll post the email address for us. But if you reach out, financialplanning@bfsg.com, we're happy to provide resources. We have a really good contact for Medicare. One of the unique things I think we've had him in the past. If you've been on our Social Security Medicare previously, his name's Brian MacArthur. He will tell you, look at the Medicare options before you join your spouse's plan, because a lot of employers, as much as they might cover that, like the employee, you might still pay full premiums and everything for a spouse to join your plan. And I think one of the things he likes to tell you is like Medicare is one of the best insurance programs that you'll ever get access to. And there's a fair chance, even still working, that Medicare might have better coverages for you. So it's always at least looking into the program and looking into Medicare and seeing, like, is your existing insurance and the cost to you actually better than signing up for Medicare when you're Medicare eligible at age 65. And so definitely, we're happy to give you resources. He is an insurance broker. He gets paid by the insurance companies. I think one thing we've heard from him in the past is like, you don't have to use them. He'll give you the options. And if you can, and then you go buy the exact same coverage, what he'd say is you're going to pay exactly the same amount. I think the insurance companies take from what you pay them to give him a cut. They don't raise what you pay them to give him, his commission. So definitely worth reaching out. We do have a resource that's really good at that, but I think always look into Medicare, even if you choose not to sign up, to see if the benefits are better than what you might be getting from an outside program. Next question is, this is a confirmation. So if you're already signed up for Social Security, you're automatically signed up for Medicare. You don't have to worry about signing up for Medicare and penalties for not signing up at 65. So I think, Arash, that goes, if somebody signed up for Social Security at age 62, are they automatically enrolled in Medicare when they turn age 65?
Yes. Medicare automatically enrolls you through the Social Security platform. You could call them opt out of it, but that is indeed the case.
Yeah, that's good. That actually gets to the next question I was going to ask you. Like, can you enroll in Social Security while you're still working and opt out of Medicare Parts A and B until you stop working?
That's right. You can notify them that you're on the employer plan and will enroll later on. So you could do that.
Yep. Next one is, do some HMOs take Medicare, or is it only PPOs?
No, HMOs, they do take Medicare. So I know some retirees, they love Kaiser, for example, and they're on Medicare. So there's definitely a variety of options out there.
Okay, next one before I move back into the chat box is, so I'm age 70, still working full time. Employer offers a high deductible health plan and HSAs, but afraid to sign up for it because I don't know when I'll stop. If I'm on a high deductible health plan, I have HSA, but then stop working, will there be penalty when I stop? I think this is an important one to actually, I'm going to ask this two ways or answer this two ways. But first and foremost, it goes to one in the chat box. How soon do you need to stop an HSA before you enroll in Medicare? Because there is a requirement. You can no longer contribute to an HSA. I think it's like 6 months
6 months.
before your Medicare eligibility. So at age 70, you probably don't want to be contributing to HSA anyways if you're going to sign up for Medicare. I think the other thing, just HSAs, they have amazing benefits to be able to contribute to. I definitely consider them a younger person's dream because it's triple tax advantaged, right, for the rest of their life while they're young and healthy. The closer you get to or getting into retirement and might have more health complications come up, it turns into like, would it cost you more on a high deductible plan if something happened? That might outweigh the benefits of saving in an HSA, right? Saving $4,000 per year, but something happens that costs you $15,000 because of age, right? At that point in time in health. Definitely worth talking to your tax advisor and financial planner to weigh the trade-offs. Okay, next one I have here for all of you. I turned 65 January 1st. I will be working part-time at that point, but we'll still have health insurance with the company. If I decide to completely retire 6 months into 2027, would I need to sign up for Medicare, like basically immediately to not have the penalties? Or is that, I think that's what gives them like the 8 month window or so, right? Like since they were still working, they can kind of push their enrollment window.
Correct. I'm just trying to find that slide. Yep.
Okay. And I think this is the last one we have so far. Is can you be double insured by your spouse and your company to get the HSA from your company for the cheapest HSA for 1 year to be able to use HSA down the road? I don't think so, because I think they have to be in a high deductible plan. So if they're on their spouse's insurance, which isn't high deductible, would it prohibit them from saving in an HSA?
I guess in this case, you would have a health insurance plan through your spouse, and then you wouldn't get a high deductible health plan by yourself. So you qualify for HSA to contribute. Honestly, I don't know, because then you would be double paying for health plan. I'm not sure if it actually makes sense to get HSA in that case to pay for all those plans and also take advantage of it.
Yeah, like you would still have to be enrolled in the high deductible plan, right? So there's still going to be some level of premiums. Like if your employer pays for everything and you would just lean on your spouse's insurance for actual coverage if something happened, there could be a way that would work. But if you have to pay for any of the high deductible plan premiums, then you might be just double paying that offsets half the benefit.
That's right. Again, you would qualify to contribute to HSA account as long as you're in a high deductible plan, right? So you still have to be in the plan to be able to contribute to that HSA account.
Great. Thank you too. That was the last question I've seen through the chat box as well. And no more questions in Q&A. Any closing remarks for the group that's still with us?
All right. Well, thank you all for joining us. It's been a pleasure. If you have any questions or have any concerns, please feel free to reach out. Be happy to individually address any questions that you may have.
Likewise. Thank you, everybody. Appreciate all the participation and questions.
Yeah, agreed. Thank you, everybody, so much for joining us. We hope you enjoyed the presentation. We look forward to seeing all of you next week, same time, same place, for Finding Your Retirement Mindset, which is a very different type of presentation. No, not as much healthcare talk. It's more about having fun and getting ready for the next 30 to 40 years. Cool. Thanks, everyone.
Thank you.
Thank you.